Good afternoon, everyone. Thank you for joining us today. We are coming to you live from Atrium Health with a historic moment. For months, we have been waiting on the FDA to approve a vaccine for the COVID-19 pandemic. And today, that vaccine arrived at Atrium Health. And not only that, we've actually already given out the first vaccines to teammates and are about to give some more teammates the vaccine. With me here today is Dr. Katie Passaretti, who's been leading the response to the COVID-19 pandemic here in Charlotte. And Dr. Passaretti was actually the first person in North Carolina to receive the vaccine today. Welcome, Dr. Passaretti.
Thank you.
So everybody wants to know, how are you feeling?
I feel perfectly fine.
Can you move your arms?
Yep, no problems.
That's awesome. Dr. Passaretti, as the first person in the state of North Carolina to receive this life-saving vaccine, can you talk to us about what this means to you?
Yeah, I mean, it's tremendously impactful to me, but more it's the symbol of hope that it portrays for our healthcare workers, for our community, for our patients. You know, this has the potential to turn this pandemic when we've been going in a direction that's honestly pretty frightening. So I'm, full of hope and excitement and all sorts of emotions today. It really is a huge day.
Our mission statement of Atrium Health is help, hope, and healing for all. And today I think we're covering all of those bases. And it's just an exciting day for everyone. The people who you're going to meet today, these teammates are on the front lines who have been in the COVID units, working day and night, putting their own families at risk. And so they are most deserving of receiving the vaccine today. So without further ado, we're going to go ahead and get started. And we welcome Dr. Jaspal Singh to be the next teammate to receive the vaccine. Over here, Dr. Singh. I'm sure our Facebook audience is very eager to hear from you. Welcome.
Oh, thank you for having me, Claire.
Can you please introduce yourself to our audience?
Hi, I'm Jaspal Singh. I'm a pulmonary and critical care physician at Atrium Health. I work at Carolina's Medical Center predominantly, and I've been on the front line of COVID-19 since this all started in March.
And Dr. Singh, you're actually on your way to working the overnight shift in the ICU unit, is that correct?
That is correct. I have to work tonight.
How is it going to feel for you walking into the hospital for the first time now that you have this protection in you?
Well, I'm still going to wear all the same protection I'm going to wear, but I'm very excited. I'm having an extra kick in my step. I feel a little bit more confident that, hopefully this gives us hope to get over this curve of the pandemic. This is a very scary time for our country, for the world, and for many patients just watching how much they've been suffering from the effects, not just the early effects, but the late effects of COVID-19. I'm hopeful that we can avoid all that and really get back to, living our lives as we all want to.
Dr. Singh, you've been a champion through and through. Thank you. I can't think of anyone more deserving. So we appreciate you. Good luck tonight.
Thank you.
And we'll talk to you soon. Thank you.
Thank you.
All right, we are going to go ahead and welcome our next Atrium Health teammate to receive the vaccine. Come on over, Mohammed, don't be shy. Gonna step right in here so our audience can see you. Could you please introduce yourself to our audience?
My name is Mohammed AlHasan, and I'm a pharmacist at CMC.
Tell us a little bit about what you do on a day-to-day basis.
Well, I'm the charge person there, so I work mostly in the department itself, make sure that all the medications that need to go up to the patient get there on time, and make sure it's the right medication for the right dose and all that. And just the distribution part, and help other professionals, healthcare professionals, nurses, doctors, and everybody else to do their jobs.
Mohammed, can you talk to us about what the impact of this vaccine means to you and your colleagues?
Well, it's very exciting. Personally, I've had family members that were infected with the virus, and this is a very hopeful time.
It's an amazing moment. You should take it in, be very proud. We're thankful for you and all the amazing work that you've been doing for so many months on end. Thank you, Mohammed.
Thank you.
All right, let's go ahead and get our next teammate ready to go. Come on over, Chloe. How are you feeling?
I'm feeling great, better.
Chloe, could you please introduce yourself to everyone?
My name's Chloe Beer. I'm a registered nurse in the medical ICU at Carolina's Medical Center.
And if you could talk to us a little bit about what your role during the COVID-19 pandemic has consisted of.
I'm a nurse, so I've been at the bedside. All of the COVID patients have been cohorted in my unit since March. So I've been caring for these patients along with my teammates since then, and holding their hands and seeing some pretty difficult things, but getting this vaccine means continuing to show up for them.
Chloe, I know you talked a little bit about how stressful the pandemic has been on you, your family, and how draining of an experience this has been. Can you talk to us a little bit about that?
Yeah, I think it's become a little bit more difficult to leave work at work. I mean, we've just seen a lot of suffering, and we think about these patients on our days off, and, we worry about them. So getting this vaccine, I'm getting it for my teammates and for the patients that we've lost and for my family.
Thank you,
It's
Chloe.
emotional.
It is, and we're here with you every step of the way, maybe not at the bedside, but definitely behind you, supporting you, and thanking all of our nurses just like you who make such an impact. Thank you so much.
Thank you.
All right, let's go ahead and get our next teammate up. Carlotta, congratulations. How does it feel?
Thank you. I feel pretty good.
No soreness yet?
No.
Carlotta, if you could introduce yourself to our audience, tell us about who you are, where you work.
Well, my name is Carlotta Lennon. I work for Environmental Services. Mainly float between, MICU, 11 ICU, 9 ICU, whatever they need me at. But I mostly work with COVID.
What does this vaccine mean to you and to your coworkers?
With this vaccine, it means that a change is finally going to come. If we all work together to get the vaccine, we can go back to our normal lives.
I don't know if I remember what that is, but that sounds really good.
Yes.
Thank you, Carlotta, for everything you do, and please thank all your colleagues as well. We truly appreciate the work you do. It means so much, and we couldn't do it without you.
Thank you. You're welcome.
Have a great day. We'll see you soon. Okay. One of you can come over here. We're going to stamp that here. And we'll let Cameron tell us if you look good. We're just going to pretend we're not. All right, everyone, and we are here with Katherine Stewart. Welcome, Katherine.
Thank you.
How do you feel?
I feel great. Very excited. Very thankful for the opportunity. This is really a gift.
It is amazing. And if you don't mind sharing a little bit about your role at Atrium Health and specifically the type of work that you've been involved with since the COVID-19 pandemic.
Sure. So I work in the lab. I'm the team lead in the molecular pathology laboratory at the core lab here on the other side of this building. So we service the entire system. And we brought up the first COVID test for the system back in March. And now we do upwards of 2,000 tests for our patients, teammates in the community every single day. So we are the silent force in the war.
Silent but critically essential and important. And Katherine, thank you for everything you do. I'm so glad you are among one of our first teammates to receive the vaccine today. Thank you.
Thank you.
Come on over, Miss Kayla. And hello, everyone. It appears we are back live, so thank you for bearing with us. There are always some fun challenges when it comes to live broadcasting, but we are going to roll with it and make the most of it. Today is an amazing day for Atrium Health. We are so pleased to share that the first vaccine shipments have arrived, and our very first teammates are getting the vaccine right now as we speak, including Kayla. Hello, Kayla.
Hi.
Kayla, please introduce yourself to our audience, share your name, and tell us what you do.
I'm Kayla Horn. I'm a clinical supervisor on the 9th floor of Levine Children's Hospital, which has been the cohort COVID unit for pediatrics.
And you know what's interesting is as COVID first hit and developed, people always thought children don't get COVID. It's not a thing. Mm-hmm. But you working in the children's hospital, you can absolutely attest that is not the case. Can you talk about how it's affected you, your colleagues, and your patients?
Yes. So I definitely think it's been hard to see the patients with COVID, as well as a lot of their family members have had it and we've had cases where they've not been able to see their own children because they have it at home. So it's definitely serious. Also seeing our teammates, like with children, the getting to see a smile, I feel like is a big deal, not seeing our faces. So just something that small, but.
Kayla, thank you.
Thank you.
So glad you were among the first group here today, and thank you for sharing your journey and all the hard work you've been doing. It is not unnoticed and not appreciated. Thank you.
Thank you.
All right, come on over. Hello, hello. How are you?
I'm well, thanks. I hope you are.
Wonderful. How are you feeling?
Feeling great.
Have you been waiting for this moment or what?
That's probably an understatement.
Tell us what it means to you to get the vaccine today, to know it literally arrived in North Carolina today. You are among the first 10 Atrium Health teammates to get it. What does that mean to you?
Well, it means a lot. I think it's an honor to be able to serve, to not only help our community, but to help our team and to advocate for our team and lead our way forward. I think it's, as some other folks have mentioned, it's an exciting time. It's a time of hope. And I truly believe that this is one of the major steps that will get us into the point of eradicating this disease and getting our lives back to normal.
As an emergency physician, can you talk to us about what you see a day-to-day in the life during a pandemic?
Sure. As an emergency physician assistant, I work in the emergency department. And my role is not only working clinically, but also helping manage some of our operational initiatives and kind of the flow and strategy of our department. And in the clinical space, certainly we've seen up and down volumes. Initially when we were shut down and we were communities were kind of locked in place, or folks were locked in place, we didn't see as many symptoms of illness or injuries. And now that we've gotten a little bit back more to normal, we've started to see that pick up again. And not only have we seen it pick up, but we've also seen more acuity, more patients presenting with more critical illness and with compromises in their disease states that haven't been taken care of in the last several months. Now that things are opening back up and people have not been able to either stay at home and manage their own disease processes on their own, or their disease state is worsened, they've now presented to the emergency department with more needs than certainly they've had before. So, of course, admission rates are higher and people are sicker, and we're working harder to make sure that people get the best care they can and obviously get onto a path of recovery.
You've been giving so selflessly of yourself for so many months. We are so grateful, Christian. Thank you for all your incredible work. So glad you are among the first, and hoping your arm feels okay and
Feels
you
great.
continue to go in there and save lives like you do every day. Thank you.
Well, thank you. Thank you all.
Hello, hello. How are you, Janine?
I'm good, thank you.
If you wouldn't mind starting by introducing yourself to our live audience, telling them your name and a little bit about what you do.
Okay, my name is Janine Morton, and I am a speech and swallowing therapist at Carolina's Medical Center.
So talk to us what your work has looked like in the middle of a pandemic.
Yes, we have really changed a lot of the things that we do. We're very excited about being in the ICUs, on the front lines, helping these patients regain their ability to eat, to talk. My colleagues, the physical therapists and occupational therapists who are getting the patients up and walking and moving, and we're all working very, very hard to get them back doing the things that they want to do so they can return home.
How long have you been thinking and, dare I say, dreaming about this moment today?
Truly since day one. I'm so excited and thankful to be a part of this and have the opportunity to get this vaccine. I think it's going to make a huge difference in getting us to the end of the line with this virus.
Janine, thank you for all the work you do, and thank your family, and you and everyone are so special to us. We appreciate it. Thank you.
Thank you so much.
Hey, Rob. How are you?
Good, thank you.
Would you please say hello to our Facebook audience?
Good afternoon, Facebook audience.
Could you tell us a little bit about what you do at Atrium Health and specifically your role during the COVID-19 pandemic?
Sure, I serve as the Chief Nurse Executive for our Atrium Health Central Market, which is our Carolinas Medical Center, Levine Children's Hospital, and Mercy Hospital. And I oversee the practice of nursing in the Central Market, over about 3,500 nurses. And really my role is to be supportive, promulgate our policies and procedures that we started since the pandemic started in March, making sure that we are adhering to best practices, evidence-based, and following the science. And today I was really pleased to be able to participate in this vaccine because I want to lead by example and let people know that's the right thing to do, not only for our patients, but our community, and really overall the public at large.
Well, you answered all my questions at once,
Oh, okay,
so now I have to think of a few more.
Sorry.
What would you say has been the hardest thing for nurses during the pandemic?
I think it's the emotional toll that it takes caring for patients and sort of having no boundaries. You go home and you face it at home, whether it's your family, somebody you know, your neighbors, and then having to come to work and deal with it at work as well. So there's really no end in sight for the healthcare professionals, and so I think that makes it a little bit harder. We don't have the option to work from home. We don't have the option to stay at home. We have to be on the front line serving our staff. So I think that's sort of been probably what I would say is stressful.
Sure. And to end on a positive, what would you say is most inspiring about what is happening here behind us today?
Well, really, I mean, I think this is just history in regards to being one of the first in the nation to be vaccinated for the vaccine. It's just sort of amazing to be part of that. And really, I think it just gives all of us in our communities that we serve the assurance that Atrium Health is always on the front line, always on the cutting edge, always innovative, and it's great to be part of an organization that has that does that.
Incredible. Thank you,
Thank
Robert.
you.
Thank you for
Thank
everything you do.
Sure.
If you are just tuning in now, just want to reiterate that we are coming to you live as the first FDA-approved COVID-19 vaccines are being distributed to Atrium Health teammates. This is a historic moment. We wanted to share it with all of you and lead by example and show our teammates rolling up their sleeves, being first in line to get the vaccine that is backed by science, proven to be 95% effective, and will help us get over this pandemic. So follow along. We have a few more interviews to go. We want to introduce you to all of our teammates who are among the first in the nation to receive this vaccine. So who is up next? Come on over. How are you?
I'm doing well. Feel
Thank you
good.
for being here.
Yes, I'm honored.
Caitlin, if you wouldn't mind just introducing yourself by sharing your name and what you do at Atrium Health.
Sure. My name is Caitlin Shannon, and I'm one of the outpatient pharmacists on our shared services flex team. We have been working to test patients at COVID clinics. So we go out to the roving sites, and my team who is going to lead or help lead the immunization effort for the COVID vaccine.
Sounds like an easy thing to do.
Yeah, sure.
I can only imagine how many calls and meetings and planning sessions that you and your team have had, especially since there was news that a vaccine was coming and on the way. Can you give us a little sneak peek at the behind the scenes of what that looked like?
Well, it's been a lot of hurry up and wait, but now we're very excited that the vaccine is here and that some of us are receiving it today. We're really looking forward to getting out into the community and vaccinating our teammates and everyone else as well.
Thank you, Caitlin. We appreciate you and all the work that you and the pharmacy services team do. It's no easy feat, and good luck with what's yet ahead.
Thanks so much.
Do we have anyone left? Come on over. Welcome. Come and step right up here.
Sure.
Oh, we got to give a round of applause. If you wouldn't mind introducing yourself to our audience by sharing your name and telling us a little bit about what you do here at Atrium Health.
Hi, I'm Ben Meek, and I'm just like Caitlin, I'm part of our shared services team, so I help out with the outpatient, and currently I'm also helping out with our specialty department.
Can you talk to us a little bit about what has been the biggest hurdle to get here today for you?
Honestly, I think it's what probably some of the other people have said. It's waiting for this to come out, trying to see more data on the actual vaccine, and really excited that it's finally here. Being mostly outpatient, I feel like I'm actually going to have a chance to do something important during the pandemic to really help other people.
I think you've been doing important work all along. I have to brag on you. This team is amazing. Thank you for what you do. So glad you are vaccinated and protected, and we'll be in touch as this vaccine gets rolled out. Thank you.
Yeah, thank you.
Anyone else? Okay. Well, we just got through interviewing and vaccinating the first round of Atrium Health teammates to receive the vaccine. However, there are thousands of others who are not first in line, but have been absolutely essential in bringing the vaccine, not just to North Carolina, but specifically to Atrium Health. It has been a huge undertaking. I cannot stress this enough, but don't take it from me. I'd like to go ahead and interview a couple of those key leaders who really helped make this happen. Dr. Sullivan, Kevin, come on over. Everyone who we talked to before, don't be shy, come on over. They're making their way over. Bear with us. I love it. A whole group shot.
Crowd.
We'll try to be as socially distant as we can. Are we all in this shot, Cam? Or do you need people to move back?
You won't be able to hear them.
You can't hear anyone?
We're not that loud? We're pretty
Just
loud.
one at a time,
Eddie's
is that what you're
loud.
saying? Okay, no problem. So I want to introduce you all to a group of people who have really been working so hard behind the scenes to bring this here. Dr. Sullivan, I'm going to start with you.
Okay.
If you want to give us the Cliff Notes version.
So Tara McGee and the rest of our IS team really worked diligently throughout the weekend, knowing that we were going to get our shipment, that we had an inkling it was going to come on Monday, and everybody just poured hour after hour to make sure that our registrations were uploaded, that we were in compliance with the state, that we built a vaccination scheduling program, and that we locked and loaded with everything that we needed to keep our electronic medical records safe. And I just can't tell you how grateful I am for everybody's work and for everybody behind the scenes that just did an awesome job. So Tara and the gang and everybody, I'm really pleased and I'm really grateful to be part of the moment.
Thank you, Dr. Silva. Kevin, I have a few questions for you.
Sure.
So Kevin Isaacs was actually, I think you might have been the first one to see the vaccine when it got here this morning. Is that a fair statement?
That is a fair statement, yes.
And you've been waiting for the shipment like Christmas morning, I can only imagine.
Only for about 3 weeks now. When we first found the date of release, we were waiting, trying to get our hands around when the FDA was going to come out with their recommendations, when the ACIP was going to let us go, and then waiting for the state to send us the final word. So we heard about it this weekend on Friday night, so we've been waiting patiently as we can since then.
Talk to us about the moment when the truck came in, the shipment gets off, and it goes into our laboratories and into these freezers that we've all been hearing about. That must have been a moment for you.
It was. We have, from the time we open the box that the vaccine comes in, we have 5 minutes to move it from the thermal shipper into the deep freezer. So being pharmacists, being stuck in a world of lab and science, we had the timer out. We were 3 or 4 people. It was complete controlled chaos as we timed everything down to the minute to get the transaction made. And then when it was time to pull the vials for today, we had 3 minutes to get them out of the freezer, into the bags, and get the rest of the vaccine back into the freezer.
Oh my gosh. No small feat.
Nope, not at all.
But you pulled it off, and we have our first round of Atrium Health teammates vaccinated. Thank you all again. Thank you to everyone. So many people not part of today's broadcast, but this has been a Herculean effort, and we are so proud. So on behalf of Atrium Health, we're glad to bring you this moment here today, and stay tuned as more information about the COVID-19 vaccine and pandemic are sure to follow. Thank you, everyone.